All right, well, let's get started. All right, everyone. Well, welcome to our second Beer and Broadband discussion. My name is Brian Hollister, and I'm the CEO of Bonfire Engineering and Construction. I'll be your MC for today's discussion alongside my colleague, Nick Densmore. I've been in telecom for over 20 years, and our business is focused on closing the digital divide for communities across the country. What does that mean? We help facilitate and fill the gap on broadband development, from feasibility studies, engineering, to construction placement services. But more importantly, I'm even a bigger fan of beer. And today I like to, we've got a great session for the team, and we love to use beer to collaborate and have great discussions. As we mentioned in our invite, our goal with Beer and Broadband is to educate, connect, and inspire. And depending on how many beers we have, we probably will do a little entertaining. This will be a conversation, not a presentation, with fellow leaders across the broadband, nonprofit, and healthcare space. I'm very pleased that they're happy to be with us together with us today and use their time. And really what's so interesting about telehealth and broadband, we're going to learn today how they're intrinsically linked together. So let's start off by doing some introductions and make sure that we've all got beer in hand or some kind of cocktail. Excuse me. Everyone are good? We good? Everyone's got a drink in hand? All right. Susan? All right, wonderful. So again, everyone, as a reminder to our listeners, you can ask questions in the Q&A section of the Zoom. We'll try and answer those questions as we go along as well at the end today. So today we have an amazing panel. We've got Will Mitchell, CEO of Vetro Fiber Maps. We've got Susan Woods, Chief Medical Officer of Amro Systems, Rachel Dixon, Executive Director of Prime Health, and Brian Worthen, CEO of Mammoth Networks and Visionary Broadband. I'd like to go around the room real quick and or virtual room and have each one of you do a quick introduction. Tell us a little bit about yourself and your company, and then we'll get started with the discussion. Why don't we start off with you, Will?
Sure, thanks. It's nice to be here. Thanks for hosting and having me. As you mentioned, I'm the CEO of Vetro Fiber Map. We're a software company based in Portland, Maine, and we deliver a fiber management mapping platform, a GIS platform, for fiber optic network design and management, supporting the deployment of connectivity infrastructure.
Great. Thanks, Will. Susan?
Hi, everyone. I'm Sue Woods. I'm a physician technologist. I've been in healthcare a long time. I'm an internist. I am still practicing. I see patients who have addiction. And I've been working in the digital health space for about 15 years. Amro Systems is working on immersive technologies, virtual and augmented reality. And we're in Portland, Maine as well.
Great, thank you, Susan. Rachel?
Sure. My name is Rachel Dixon. I'm the Executive Director of Prime Health. And also an eHealth commissioner for the state of Colorado, chairing the state's Telehealth and Broadband work group. Prime Health is a nonprofit that focuses on improving healthcare through innovation and collaboration, really working across all sectors and using technology as a tool to advance health equity, quality, and cost.
Awesome. Thank you, Rachel. Brian?
Yeah, I'm Brian with Mammoth Networks and Visionary Broadband, and we're a broadband provider for a lot of the Rocky Mountain region and have a big presence with, we just finished putting the finishing touches on the Thor network in Colorado, which connects a number of hospitals, and we're excited to be a part of this conversation. Thank you.
Thanks for joining, everyone. All right, Nick.
All right, guys. So obviously the conversation today is around broadband and telehealth, telemedicine, but if you're like, if you're like me, you're not exactly sure what exactly that means. So I've read a couple of different articles recently about what telehealth is, but obviously, Rachel, Sue, I think, you guys are clearly the experts. So let's just start off the conversation about what is it? Let's define telehealth, let's define telemedicine, and get that kind of on the table right off the bat. So either one of you can jump in.
I'll jump in. So it's information and care at a distance. That's a really sort of simple and generic way of talking about telehealth. I can tell you it could be synchronous at the same time. Telephone is telehealth as well as what we're doing right now, video, but it can also be asynchronous where like secure email or monitoring data that you submit to your healthcare provider.
Yeah. I would add, Sue nailed it. I would add, I tend to think of it as anytime we're using technology to enhance or support the delivery of care. So also things like symptom trackers or apps on your phone, devices for in the home, things like that kind of also support that communication, to Sue's point about the synchronous and the asynchronous.
You guys everybody have the same opinion? Brian or Will, Brian, everybody think we good with the definition of what it is?
I've seen a few definitions, and what's interesting is it really breaks it down into ongoing healthcare and treatment. So if you think about splitting it up, it's as simple as an Apple Watch and the health app and the fact that it monitors the heart and whatnot. And then there's the actual interaction as Sue spoke of, where it's two-way, it's synchronous with a healthcare provider. So it's good. It's easy to call telehealth as overarching, covers everything, but there's multiple aspects of it. In fact, in rural America, we've been practicing telemedicine for years with radiology going to other hospitals and hospitals sharing radiologists and sending stuff back and forth. And that's why connectivity has always been important, not just during COVID.
I think one of the challenges is, terminology does matter, and it really depends on who's defining it. So I think healthcare by itself tends to focus on a very narrow sort of telehealth, remote monitoring or video, but I agree with Rachel, but I don't call that telehealth. I really refer to it as digital health. And connected care, because not all of it requires a healthcare clinician. Not all of it requires a health provider or a health system. People can do things on their own. They can do peer online support. They can use mobile apps. They can use devices on their own. Some of that data may interact with a healthcare professional, but not all of it needs to.
I think that's one of the interesting and fun things, to Sue's point, is there are about 5 different words for it. So depending on who you ask, it's telehealth, telemedicine, virtual care, digital health. I even see some blending between that and health IT, right? And some of what that is. So it's fun in that you can, and then also even at the government level, when we look at policy, there are differences of opinion in terms of the definition of telemedicine used by at the federal level with like Health and Human Services or Center for Medicaid and Medicare versus like at the state level. It's defined differently state by state. So it's still very much an area in development, which I like.
Well, I think it's right? Broadband, you have, the gig economy, gig access, you have high-speed internet, you have broadband. A lot of it's the same thing, but it's obviously emerging, it's growing, leaps and bounds still, and just like telehealth, right? So we like to make it just as confusing as possible for others to enter the market.
Yeah.
Sue, I think, Sue, it was you who told me that the definition expands into the sort of consumer space too, of actually just interacting with the healthcare system or your doctor and having an online portal of some kind with your insurance company or your provider system, and setting appointments or accessing records and results, from consumer to provider. And then, if you're going in and getting some sort of care, they're sharing electronic medical records, and that's behind the scenes part of the whole thing too, right?
What's interesting is there was just an article that came out on March 11th, and it was about basically new venture deals that have basically been funded since the pandemic started. And the top three deals were basically biotech, health tech, and fintech. So I guess, kind of proving that what's going on right now, that even in a pandemic, there's a lot of activity in obviously the health tech space. And I guess it begs the question, what factors really do play a role in the adoption of use of telehealth, right? Obviously we're talking about broadband here too, but what are those factors that really, impact all of us using it? I mean, I know I've used it myself, but what do you guys think?
Well, I think most on the nose for this meeting is internet and technology infrastructure, both for patients and providers. And that goes for urban and rural areas. So even in Denver, we're having a lot of conversations around whether or not it makes sense at some point to look at having Wi-Fi be a free public utility, since there are so many people who can't afford the $15 a month for internet access, or who don't have technology that's compatible in the home with a lot of the services that we provide. And then when we look at rural communities, or even just, facilities that have older buildings, right, where the internet's not very good, or the wiring is old, or whatever that looks like, of broadband and infrastructure is I think definitely one of those fundamental factors. The next factor that I see a lot of is policy and payment in the healthcare system. So making sure that there's a healthcare system that's supported in terms of allowing providers to deliver care in the way that they need to. And we still run into barriers around, in Colorado at least, barriers around what types of providers can be located where, and where the patient needs to be located, or what kinds of services you can provide, and what the requirements are on those. And a lot of that can be very restrictive, and tends to have a hard time keeping up with how quickly the technology and all the different care delivery models evolves. And then just making sure that we have reimbursement models that align with that. One of the things that's really cool about telemedicine is that it really supports this movement towards value-based care, and really improving overall the outcomes of care and the cost of care. But it's still a new space in terms of how do we evaluate that, how do we measure those outcomes, how do we really assess that cost and prove it in a way that we can justify its continuity. And then I think the third area, factors that play a role, or so I'm listing barriers, which I think which is not necessarily the same, but the third area is just is knowledge, making sure that people kind of understand it, know that they can access it, how to access it, what it means, what to expect, that it is good care, all of those things. And so factors that play a role in the success of adoption and use of those technologies is really thinking about ways to address those three areas.
Let's ask everybody here, does everybody, if you had to call your doctor right now, do you know if you could actually use telemedicine?
Well, we just tested this a couple minutes ago. I called my doctor to schedule time to try to do something virtually and to understand if there was an option. And they knew of nothing. My doctor I've been going to for years, just family doc, right? Because I'm not exactly really wanting to jump up and run and obviously, go into a place to have a physical right now. So I wanted to know if there were options. And from my doctor, there wasn't. So I feel like education may be a potential barrier here. I mean, we obviously have to have internet access, but there's lots of us that do have internet access already. But I'm not sure if we really understand everything that's available to us already. And while my local doctor doesn't, it's obviously forcing me to look at my provider and see what other options I have. because it's probably smart to still do a checkup now that I'm older than 29.
Hot tip for Colorado, to your point, Brian, if you do need a provider, is that all of the commercial payers, so Cigna, United, et cetera, do have telemedicine solutions available through the payer that you can use. So that's always a backup option. And right now, copays are waived because of COVID. So
it's an interesting comment in the chat that's from a provider, I guess, that's listening or watching, that they're concerned about wanting to advertise because they're worried about reimbursement. So that's interesting.
yes.
So,
Yeah.
you asked Nick about adoption, and in general, adoption requires things to be easy and things to be valuable. So but we have to think about healthcare now like BC, before COVID, and AC after COVID. So BC, healthcare was not adopting telehealth to any great extent. I mean, there were pockets. I mean, large systems. I spent 10 years at the VA at the national level, and they've been doing it for ages. Big systems like Kaiser Healthcare, and I think you have Kaiser in Colorado. You know, they've adopted it because they want to keep people out of the hospital. They want to keep people out of the emergency room. But most healthcare isn't designed that way. Most healthcare is designed fee for service. You see somebody, you get something done, and they get paid. So the whole sort of easy and valuable wasn't really an option in most healthcare. Today, all bets are off the table right now. We've got healthcare clinics and hospitals that are going down the tubes unless they provide virtual care. All the rules and regulations have been relaxed. The reimbursement has been heightened, and everybody, it's sort of a wild, wild west out there, including low-income rural clinics who are trying to adopt telehealth. And so there's been this dramatic change. But one of the things that technology always uncovers is what happens on the ground. Like, does it work well? Does it not work well? I mean, what happens when you layer on something like telehealth on top of the existing healthcare system, you start uncovering all the facts like the infrastructure is not really there, the support's not really there. They can't, reach out and help people who are struggling to get in or use the technology. So it's a pretty interesting, dramatic time.
It's a very dramatic time.
My sister's in this field. She runs the Pacific Business Group on Health, and they're sort of a payer coalition working on really cost control and quality metrics and that kind of thing from the buy side for large employers. But she's a bit of an expert, but I'm not. But she tells me, recently she was telling me that a huge number of independent practices, those that are left, primary care practices, are at risk of going under. And it just dawned on me, well, yeah, they're like a retailer or a restaurant. If you can't go in and buy services, they're not getting paid. So this shift to online is really, necessary for them to survive, even they need to get paid by delivering services like this, or however they can do it remotely and digitally. So I thought that was quite telling.
Yeah.
I agree.
So some Colorado stats are that in Colorado in the last 2 months, more than 40,000 healthcare workers were laid off or furloughed. And at the same time, we see that more than 86% of providers have switched to delivering services over telemedicine, whereas BC, before COVID, it was less than 20% across the board. So it's been an insane spike. It's really fascinating to watch. What's also interesting within that, kind of going back to this telehealth definition, is that the majority of those visits have actually been over telephone. There are still quite a lot of some interesting challenges related to live video visits, especially in the space I work in, which is with sort of low-income communities and rural communities, which have a lot more barriers related to tech access.
Yeah, I mean, clearly, I mean, and I'm not making light of it, but I mean, you can only do so much telemedicine, right? I mean, there's no proctology exams over, telemedicine, right? So,
Right.
You are making light of it. You are.
yeah.
Well, you could do,
I mean, I'm
most,
just saying, there's only so much you can do. I mean, so there's a line of what's of how far that telemedicine can go without obviously having a physical appointment, right?
Why aren't we going to push?
docs tend to say that. You sound like a doc. But when it really comes down to it, 90% of what you do with a clinician is to talk, is to get a history. I mean, there was a comment, it's true, if there's proceduralists, obviously that you've got to do face-to-face. There's a comment in the chat box about mental health, behavioral health, and yes, they've been way ahead of the curve doing virtual care for a long time, because that is talk therapy. But don't underestimate how much you can actually accomplish in a virtual visit.
I want to go back to something Rachel said earlier, and it's about adoption. And I think of the time I walked into my parents' house and they were FaceTiming with my kids. Yeah, they were incented, right? They wanted to talk to my kids and see them. And they were talking to my kids remotely, and I just run by. We live in the same town. But they were using FaceTime before I was. And now if you think about all the people that are now using Zoom and walking their children through Zoom, Google Hangouts, or Meet, Skype, FaceTime, whatever, for schooling right now, suddenly this ability to receive and send information in real time has changed, because it comes down to ease of use. These are the same parents that I talked about when they had a VCR. They can't set the clock on it, but they figured out how to use Netflix, right? So there's that. Once the technology becomes easy, the adoption comes in, right? It's just right now it's just a swirling windstorm of everybody understanding the technology. And then if you're a clinic, how do you get the word out? You do that, right? There's no traditional marketing methods anymore. You can't put something on the radio. You can't put something in the newspaper or on TV. There's no way to reach everyone. So how do you get the word out even if you offer that? But it is about
do a TikTok video.
What's that?
Do a TikTok video right now.
That is very explicitly the one place that is still considered not HIPAA compliant. in the emergency, they waived all the HIPAA restrictions for like Facebook Messenger and all of that. They were like, except TikTok, no TikTok, which I thought was really funny that needed to be said, but probably did. So,
well, I guess to play off Brian's comment, I mean, so adoption, right? I mean, so obviously different people in different areas have different levels of, and let's stick to the broadband piece of this, right? Of broadband access. What's the base requirement, to truly do effective telehealth online? Now, you put aside the phone, obviously, Rachel, you mentioned that they do a lot of that, but from a broadband perspective, is there a base technical requirement of things you have to be able to have a good telemedicine appointment?
yes.
Well,
Or go Sue.
Jinx, everybody drink.
Okay. I was seeing patients virtually yesterday, all day, and a lot of them were on the phone. And one individual was a new patient, and I spend a lot of time with a new patient. And we started with a video, but this person was actually in their car because their kid was at home and they didn't want the child to hear the discussion. So they were in the car, and it worked for about 15 minutes. And then it was, I got to call you because you're going in and out. So yes, and you guys probably know this better than I do, but I think you need at least 5 upload to be able to have a good connectivity. But remember, it also has to do with who else is using the service in your home. So, you know, how many devices there are. So you can't just go with one individual, but you guys know this better than I do.
Yeah, that shared bandwidth is a problem for certain network technologies, and Brian knows this better than I do. But you know, we're in the business of helping companies that are deploying fiber to the home in a lot of places. It's not going to go everywhere, but you know, a good wireless connection is also, you know, certainly adequate. But we experience that bandwidth overload. Well, Sue, just today I was on a call, and a neighbor in a pretty well-developed area with what you would think would be good broadband connectivity was on a Zoom call like this, and he couldn't speak. The voice wouldn't come through. It was just dropping out. So that they had reached a fail point, and it was because 3 or 4 other people were in the same household using the same bandwidth. And so certain network connections are, you know, not robust enough to support even this kind of conversation.
That's
Well,
right.
just since this all broke out, COVID, I've had 150 meg broadband cable connection, and it's always been amazing, fine, right? It serves all our needs. But now, not only with the, you know, 4 people in the house being on a video conference, which obviously is the hardest experience to make perfect, right? Because if we have a problem, we're hearing and seeing it. But now that all my neighborhood is also doing the same exact thing, luckily for us, there was an option where now I brought in a fiber connection to our home, and we're getting, you know, obviously a lot better internet, but it's the experience. It's actually the big difference, Will, that we saw was the latency. On the other technology, that latency was really affecting our two-way communications. And since we're doing this kind of stuff all the time with clients and employees and partners, it's vital. So luckily for me, I live in the middle of Denver and we have options, but that's not the case for many.
You know, Brian, you were talking too about it has to be easy and accessible, and I don't know. I think Nick, you asked if we had access to telemedicine or ourselves, and I do. I haven't used it, but it's called Teledoc, and it's provided through the coverage we have, the family coverage. So you can dial up and have I think it might cost a small copay. They might even have waived them right now, like you suggested, Rachel. But Teledoc is an app that's, I don't know, there are probably lots like it, but that's one that I have on my phone and have access to through my insurance plan. But what's more intriguing to me is on the mental health and behavioral health side of the equation. You know, we all know somebody who's suffering from depression or anxiety or some other, you know, affliction or suffering on that front. And there are apps now that meet people where they are that I've been looking into for, you know, friends and family. And one's called Talkspace.
Mm-hmm.
I think they're doing a lot of advertising. You asked about how to advertise too. They're out west, they're in Silicon, they're, you know, on billboards and things, but with movie stars, you know, backing them. But imagine the prevalence of depression and anxiety in the younger population, then they're not going to probably benefit as much from once a month going into an office visit. But with this kind of tool, they can text a counselor or get on FaceTime with a counselor whenever they want, wherever they are. And I think that's a pretty important shift. You know, hopefully that sort of takes root.
So I guess a question, I mean, obviously, you know, there's a lot of players involved in telemedicine and telehealth, right? So there's the service providers, right? So people can buy broadband services. There's the hospitals and doctors. And then even, you know, further back behind the scenes, right? There's the people like us that, you know, develop networks and deploy networks and have software to help create networks. At what point, I guess, let's maybe start on the service provider side, you know, do you help encourage use of, you know, one more application of why having broadband is important? Like, do service providers need to get more involved in the promotion of this new application again? I know it was around before COVID, but even like, is it something that we should all be promoting?
Well, I guess where does it fall, right? Is it federal? Is it nonprofit? Is it, the private sector? I mean, when we think about education, I'm really curious to get the team's thoughts on it, because we clearly have seen, to Rachel's point, a huge uptick in use, right? You've almost been forced to use, and thank goodness there's been this option for many. It's clearly probably helped flatten this curve, but how do we get the word out? What is the right means, right? Because there's capabilities out there today. I mean, Rachel, I went to your Prime Health Summit, and they awarded tons of money to all these amazing innovators doing all kinds of remote healthcare. And the whole time, as a broadband guy, I'm thinking, that's awesome if you have connectivity. And there were so many amazing innovations, but what is the means of education, do you think?
So emphatically, yes. I think that as much as possible, any industry that relies on broadband, or any sector that relies on broadband connectivity, which is, so I guess to back up for a second, access to the internet and good internet has really become, I think, a basic human right and something that should be a public utility. Whether or not you have access to adequate internet influences your access to education, healthcare, economic opportunity, the quality of those resources, your overall public safety in your community, right? Whether or not your fire department and police officers and people like that have the connectivity that they need. And so it's interesting, Brian, and we've talked about this before, that we see quite a lot of advocacy in the healthcare space for broadband, that our hospitals need broadband or need internet connectivity. I've had, we were talking about mental health, and I did a program where we brought free telepsychiatry, live video, and consults and all these other things to rural hospitals to address these significant behavioral health shortages in our state. And one of the hospitals, I was like, I've got this virtual mental health practice. We'll give you everything you need. See your patients completely free, support you however you want, unlimited, all of that. Like, it was a program that I was doing that was paid for by the state, so it was fine. And we had a hospital CEO that burst into tears in a meeting because they were having such out of control issues with behavioral health and substance use and all of these needs. The nearest mental health clinic was 4 hours away. And they really needed this service, but they couldn't use it because they could only check their email once a week, apparently, when like some sort of satellite went over them or something. Like, they were having such bad, I wish you would know more about, I don't know if that's technically accurate, but it was basically like there were only 1 or 2 times a week where they could even check an email. So even trying to Google something, or look something up or verify the dosage for a medication and things like that was hard to do. Same with education in any other space. But I don't see a ton of coordinated effort or coordinated advocacy in the community. I see advocacy in education, advocacy in healthcare, advocacy in economic development. We see initiatives like smart cities. We see and then we have Office of Broadband, Office of IT, Office of eHealth Innovation. We have all of these different people that are working on it, as well as foundations that fund it through a lens of healthcare or through a lens of something else. And so, that touches a nerve for me, and that this is something that everybody can agree we need. And that is one of the biggest influencing factors today in our society as to what your quality of life is going to be in your community. And it's also, on the positive side, a really powerful revitalization tool for rural communities and small towns and things like that, to be able to continue to do that. And also, if you think about it, as a way to address the housing crisis. Yeah, I think broadband should be important to everybody, and that we should do more to advocate for that in our communities.
There's nothing like
That's a lot to unpack. That's a lot to unpack.
Started.
Sorry, Sue, go ahead.
there's nothing like losing money for people to pay attention. And I couldn't agree more. I think healthcare, education, energy, work, everybody's suffering from the same thing, which is how do we provide our services? I think of this like a bridge. I mean, they build bridges differently now, but it used to be, they start building on one side and then they start building on the other side and then they meet, right? So healthcare and education, they're scrambling to figure out how to provide what they do normally in a virtual world. Okay, workers, employers, same thing. But on the community side, on the consumer side, children, people, families, who's paying attention to that digital equity? Who's paying attention to the last mile? Who's paying attention to digital inclusion? People can't afford the connectivity. They don't have the devices. They don't know how to use them. So it seems to me that what you've been talking about is a perfect opportunity to start aligning across these ecosystems for the same exact thing, which is to really start empowering our communities and creating those public-private partnerships to do what needs to get done. Because, I mean, healthcare is not going to support the people in their homes. They're not going to do it. Education's not going to do it either. And it's really behooves the communities, the local governments, the state governments, the federal governments, the private sector to come together and figure out how to do that digital inclusion piece.
So Brian, and Will, so you got on the you're on the back end, right, of the infrastructure of, you are what I'd say 90% of the population has no idea that goes on that allows, things to work. What are you guys considering now? Knowing that, this is coming and it's, AC, what are you guys considering from network planning to promotion to education? What are you guys thinking about relative to this topic?
I think that's an interesting part of the discussion. We've been talking about promotion of telehealth and how a provider could be doing that. But I can tell you this, having been in this business 20 years, the adoption of technology happens on its own. So once something's easy enough to use, it is used. And once something, like the example of my parents again, once it's easy enough for them to use, they'll use it. Once Zoom is easy enough for a third grader to do their schoolwork, they'll use it. There needs to be a common acceptance and ease of use for telemedicine and telehealth. And there's nothing I can do as a provider to change that, right? I could promote that all day long, but I just have to be ready. So we've a few years ago we realized we really can't shape how people use the internet for whatever reason, right? We tried to include certain services with internet, whether it's voice or TV or whatnot, and everybody wants to do their own thing, but it has become a utility. And so in the last couple of years, we've just shifted to planning better networks and planning bigger pipes. The discussion was had, Will mentioned his upload and multiple users in the home sharing an upload. I talked about this in the last couple of weeks to multiple people. We've seen our work orders double because people are migrating en masse off DSL. It's too latent for video calls, it's too latent for voice calls, and it doesn't have the upload. And so as a provider, we're simply preparing for that wave. And what's interesting about this is COVID has brought it all to the forefront, right? And we know what's coming as a provider. And Brian and I were talking about this before the call. We know that there's a storm coming, there's a wave, and it's an opportunity, but it's going to be a huge amount of pressure for everyone in the broadband industry to keep up with what's going to happen next, because there's going to be a question of whether schools are in session come August and September. There's going to be a question as far as when medical professionals who are furloughed go back to work and what that looks like after this. So I could talk all day long to my clients and say, I'm going to hand you a device. I'm going to hand you a Fitbit. I'm going to I'm going to defray some cost of an Apple Watch so you can monitor your heart. But there's some people that won't use it. There's some people that say, I'm an Android user, right? You don't have a single product to appeal to everybody as a provider. But what we realized is we have that one product, and that's the pipe.
Yeah, I think I.
Yeah.
Go ahead, Will.
We're one step upstream even from Brian. You know, we provide tools. We're in the kind of the efficiency business for the design and deployment of those networks that Brian's deploying, and we work with Brian's company and many more like his around the country and even globally. And they're all sort of saying the same thing. There's this sort of pent up demand and the surge in demand that's just gotten really exacerbated and intensified. And networks are going to have to get designed and deployed a lot faster to a lot more places. So, you know, we're trying to help that, you know, in that regard with providing software that's easier to use, you know, but again, we're way upstream. You're connecting the providers as well with your middle mile networks, and that's critical. There's a lot of investment going on into that space, connecting rural health facilities and hospitals and others and providers. A lot of the people we talk to are more worried about that last mile to the home and doing the drops in the rural neighborhoods and connecting the actual homes. So on both sides of that bridge, you know, the provider and the consumer, I guess, both need the same kind of high quality connectivity to make this work.
Yeah, I think there's an evolution is happening right in front of us. You know, we overnight went from businesses driving traffic during the day and residences driving it in the evenings, and overnight we flip-flopped that traffic. That's had a huge impact on networks globally. You know, and as we think about, you know, designing these networks, there's a lot of time that goes into trying to come up with the best design and you know, utilizing, you know, efficient tools like what Will has, and then, you know, working with service providers like Brian to figure out, well, what do you have in place? What kind of existing assets can we leverage? Because especially as we're building these networks in rural America, you know, the cost per customer is obviously very expensive, but I do believe we've been seeing this evolution happen over several years now, where more and more rural communities are saying, hey, we've got to go build this network ourselves, right? I think in the chat room, folks have been mentioning like Chattanooga is a very high profile, great town. Shout out to Chattanooga, is, you know, really doing some really cool things and it brought gigabit to everyone there. And that's no easy task, right? You're building infrastructure that's physical, and it's something we can't, you know, outsource to cheap labor by any means. So, and there's uncertainty. We're not sure exactly where the build's going to be, because there's a transition happening right now. I mean, we have 3 office locations hardly being used, and most of them have 2 pipes in there for redundancy. And so, what are we going to do? But the good news is this pent-up demand is coming, and it's going to be actually a good news, bad news thing, right? Because there's only so much product out there that can be produced, say for and other things. You're going to see a lot of these communities that know they need to go ahead and build these networks, finally decide to go ahead and do it, or they've been sitting on the sidelines because it's a lot for community to try and go build something they've never done before, right? If they're going to take that on themselves. And it's just one aspect of broadband development. And you're going to see more and more of these folks jump in and say, let's go. We've got to do this for the community. But then that's going to have a huge impact on supply and demand. There's only so much capability across the country to do this type of work. And the work has been very strong with 5G and just the proliferation of broadband across the country. So it's going to be a good news, bad news kind of potential, you know, challenge that we're going to have to work through.
And as for those who were on earlier, saw Will's cartoon, you know, 5G, you know, it is the root of all evil right now, right? Just kidding. So let's I guess change gears a little bit and talk about the, I guess the roadmap for both telemedicine and broadband. Is there, or should there be, conversations that there is a truly an integrated roadmap where it's not just telemedicine goes down one path, the broadband companies, both from network design to implementation to servicing, go down a different path? Should there be an integrated roadmap? And if so, who leads that?
So I can speak a little bit to what we're doing in Colorado around that right now. That is 100% something that we're trying to figure out, and really how do we coordinate across sectors as well. So we're very fortunate to have a really wonderful Office of Broadband here in Colorado with some really kind of creative, open, easy to work with leadership. And then we also have a number of really amazing foundations. So most of all in Colorado, we see that the Colorado Health Foundation is really interested and has also identified this need for broadband and the impact it has on communities. So they have been doing kind of a mapping exercise of Colorado for the last year of where there are communities where improving broadband access would make a big impact related to equity. So for those of you that aren't familiar with equity, that's like making sure that everybody has the same opportunities and the same rights and the same resources regardless of where they live, how much money they have, or what other circumstances they have in their life. And so that's been a really exciting initiative. And I think that, frankly, because broadband is so expensive, right? Building internet is so expensive, and funding that comes from the federal government can be complicated. It's really nice when we see foundations and investors at the table. So there are also a number of investors that we're seeing in Colorado, like Arcturus, that are investing in the building of broadband networks in communities where they think there'll be a payoff 10 to 20 years down the road, related to like economic growth. And so those initiatives have been really big. And then also the local municipality stuff in Colorado has been a big deal, as well as the electric co-ops doing that. So those are a lot of the strategies that we're seeing, at least in the healthcare space, of ways that we can do this. But our big initiative, at least at Prime right now, is to try to build more bridges of collaboration so that we can have kind of a bigger coordinated ask, as opposed to, at 3 different sectors from the same community submitting proposals for funding. Rather, let's instead have a big push that we need this funding and we all agree. It tends to be a lot more powerful when we have those big numbers and that big picture, as opposed to this one hospital. It's really not this one hospital, it's this entire community and every school, clinic, and other resource within it.
So I guess, and maybe this is to Brian, or either Brian, I mean, obviously rural communities they have service providers, they have WISPs, they have electric co-ops, they've got a lot of different people there. I mean, to Rachel's point, how do you, if you're trying to get the big picture, you're trying to get everybody involved, is there a central forum? Is there some place where all these people that are basically constituents in trying to kind of bridge that digital divide, where can they come together? Or is it, or is it just the piece parts right now?
Hollister, you want to start, or you want me to start? What's interesting is it's about amenities, and there's been discussion on Chattanooga. That's a good sized community. What about a community the size of Gunnison or Crested Butte or somewhere in the Rifle, Colorado, right? What happens, and I see this a lot, is there will be a push locally. So someone becomes vocal or gets frustrated, and they've got they've got a DirecTV or a Dish service, and they see what's advertised in Denver. They see what's advertised in Colorado Springs, and they say, why is that on one side of the fence and I'm on the other? And so there's this push towards broadband in that community. And what happens, I see, is at some point the community as a whole draws some sort of shape around the group they're trying to capture. And I've seen situations where somebody lives 10 miles out of town and they're the ones that are being most vocal about broadband. And it goes to an RFP, and there's a public-private partnership formed, or somebody does it on their own, or somebody enters the market new, and it still doesn't solve the problem for that person 10 miles out of town. So what we've got is an amenities problem. So it's no different than me having access to 3 good restaurants within 10 miles of my home versus going to Denver and having 30 good restaurants, right? I don't have options for broadband when I'm 10 miles out of town. I don't have options for a good upload. I might be on a satellite. And so I'm always going to have this amenity problem. And I'm just going to use that word because I am going to be at a disadvantage because of where I live. And the most interesting thing about this, when you pair it with the question of what am I doing to prepare? One of the things we've discussed in the last week is what happens when people in the metro markets say, you know what, maybe there's too many people in this area, and I want to get out into the free air, right? And I don't want to be exposed to a COVID-like environment in the future because my healthcare can't keep up. So what's interesting is there's people now in the metro market looking over the fence at rural saying their hospitals are open, they're able to take patients, but they can't do that in New York and LA and or San Francisco, right? So there's now a metro focus on the other side of the fence. And when those metro folks, and this is what we've discussed internally, when they start migrating a little bit, it won't be en masse, but when they move to that 10-mile home that's 10 miles away or out of town, they're going to have a broadband problem. It's an amenities problem. And the broadband divide is actually rural and metro, and it always will be. It's not class so much as distance, because and we've all said on the call, everybody on this call has said it, the cost to construct broadband is massive. It's huge. And no matter how much attention to it right now, it won't be solved next year.
No, I think the only thing I would add to that is, as we've seen some of those developments happen, I mean, there's been a lot of positive things, but the challenge is, even in those areas, they're still going to treat some of it, while it might be a tier 3 town or 4, they're still going to have an epicenter of what's going to get broadband first. And even if they have that person that's 10 miles away, they're at the very end of that build cycle, right? Because it's going to take the longest amount of time for them to see a payback, even if they're getting government money as well to help fund it. So we still have a major challenge with density. And the smaller the density, the more it costs, and the harder it is for you ultimately to have connectivity. And so there are some options like a satellite type connection, but you can't do what we're doing right now on satellite. The propagation delay and the upstream challenges just do not allow this to work. It's better than nothing, right? There's still some aspect of care that could be had via email and things like that, but you're not going to have a two-way communication.
So as we, sorry, go ahead, Sue.
You know, part of the issue of a roadmap is that everybody has a shared understanding of what they're talking about, and that it's the same. So a lot of people in healthcare and education, they don't necessarily understand the pipes. They don't really, they'll throw things out and use terms all the time. They talk about 5G, but it's really important. So there's two things I think that are real opportunity, and Rachel talked about it a little bit. One is there are huge natural allies happening right now in education, employers, healthcare, across the board. There are huge natural allies that want the same thing. They want affordable, reliable connectivity. And yes, it's rural, but I have to throw in, there is a digital equity here problem here that has to do with people of lower economic income. They might have flip phones instead of a smartphone, and they have no access to the internet, and they could be in the city. So it's not all rural. The demographics to access is rural and income, period.
Yeah.
But just back to the allies. So you have all these natural allies that I think need to be simply educated. Like the federal standard of 25, down 3 up. It ain't working. It ain't good enough. The data's not correct. The idea of, Maine has, 90% connectivity is wrong. So I think it's really important for the folks in broadband and connectivity ecosystem to inform people very clearly and simply with some very simple, consistent messages about what it would take. But in the other direction, the people in education, the people in healthcare, they are the ones who should be telling the stories that are going to provide the advocacy. They should be the ones who are providing the information about what they can achieve through virtual care, but what they can't achieve when that care can't be provided because there's not enough connectivity. Those are the stories that are going to make or break where we need to go.
Absolutely.
Well said. Oh, well, I just feel like it's like a siloed approach right now, right? And this is an opportunity. This is why we really started this series, was trying to bring people together to share these stories, and how can we be a catalyst to start connecting some of the dots. There's a lot happening in innovation in healthcare, and there's a lot of various funding mechanisms for healthcare to try and help with the broadband component. And then there's also lots of funding associated with just broadband on its own. And I feel like they're not working well together, right? And I'm not sure what the answer is, but I do, Nick and I have had these conversations. Through this type of situation that we're going through with COVID, this is an amazing opportunity, actually, in the realm of innovation and bringing groups together, because they're really having the same exact problem, right? So we've got to be able to get this connectivity. And Susan, I'm so glad you said it. I mean, right here, our Denver public schools, I think it's like 12 to 15% of the kids don't have broadband access, right? So as they have started to work from home, they're not, right? And they're trying to do a lot of things, Wi-Fi hotspots, this and that, but still so many don't have just the basic access to keep up with their classmates and what's going on, right?
And I think that's the stark reality of this, right? Is who would have thought that there'd be that many issues in a metro market, right? And the point I was making earlier in response to Nick's question is, no matter how broadband is looked at, and again, everybody on this call recognizes the need for it to be available and universal and whatnot. But the fact of the matter is, when people look at a broadband problem, they actually try to solve the equation for most. And that's what we're seeing now, is the equation has been solved for most in the metro market. Sue was pointing out low income. You've pointed out students that without sufficient broadband to perform schoolwork. And I see the same thing in rural areas where the guy that's 10 miles out of town, his problem's still not solved, although he may have been the one that advocated for a broadband solution. So we've got to get out of the mode of solving the problem for most and solving it for all.
So on that
I
note,
love the positivity we're talking about here.
So I guess on that note, as we're rounding out the hour, let's talk about how the rest of 2020, right? So, obviously there's a lot going on, but, where do each of you see the rest of 2020 going, both from, I guess, momentum and funding, right? I mean, at the end of the day, obviously there's a lot of money thrown towards this, but what's your guys' prediction? What do you see happening for the rest of this year and going into 2021, both from the energy and momentum behind both on the healthcare side, nonprofit side, service provider side, as well as the funding?
Well, in Colorado, we've been using the expression "never let a good crisis go to waste," and I think we hear quite a lot in public health. But in that sense, broadband is definitely top of mind, and so in Colorado, at least, what's exciting is that we're seeing a ton of alignment across most of our state agencies and departments, which if you've ever worked in government at all, is not always the case. So that's been pretty cool to see, and just a lot of consensus around that. We're also seeing that our legislators are really advocating for that much more vocally at the federal level, because much of this is determined at the federal level with the FCC and other groups too that have influence, like the Office of the National Coordinator for Health IT that can support, and HRSA is a big voice in that conversation as well, Health and Human Services. So that's been nice to see. And then again, talking about foundations, and it's pretty cool. We actually have Bruce Byington as one of our attendees on this call, who's the Chief Innovation Officer for the Colorado Health Foundation. And so they have been again, mapping broadband and leveraging their resources and their pull, since they work across a number of sectors, as well as with, pretty much all the foundations in the state, to look at how can we work together to address this in communities to advance equity. And then the nice thing too about a funding strategy that we've seen work well in Colorado is this concept of federal matching dollars. And that's one of the places where the state has been really clever in pulling in resources, and where the foundations have been really useful too. And that typically, if you can show that you have a certain pool of funding, right now we have a 90-10 federal matching. So if we can pony up 10% of the funding and show that we have that, then we can get a 90% match, which is huge, right? That takes us from $100,000 to $1 million. And so there's a lot of those initiatives happening. And then the other place that we're seeing a lot of really good work at, so kind of going back to the foundation and how we can use dollars, is seeing foundations partnering with investment groups. And so when we're thinking about how do we raise the capital needed for innovation, partnerships between foundations and investment groups to leverage those different resources and make that case of, hey, invest your money here in this thing that's important to us, and we'll support that funding. And then, all of that works really nicely, especially then when we look at that coordination with state funding approaches for federal matching dollars. And so I think the more that you can see this kind of collaboration, and again, to that point of these different sectors, there are really amazing foundations that focus on education, really amazing organizations, both in the investment community and in the nonprofit community, that focus on economic development. I think smart cities is an exciting opportunity and place for more innovation in terms of how that's been working. And Microsoft has partnered in that Smart Cities Alliance in terms of how do we look at designing communities that do have nice ubiquitous Wi-Fi access and technology wired in. So yeah, we see James on here, people using the Microsoft donating access points. So I think that there are a lot of interesting things there in terms of all of these different public-private partnerships, and really leaning on that.
There's a renewed kind of imperative and momentum towards investing in connectivity infrastructure from the federal level too. And a lot of people in our space are gearing up for this Rural Digital Opportunity Fund RDOF auction, $20 billion going out to sort of facilitate or subsidize unserved and underserved area build out and connectivity. And in the scheme of things, it is expensive, but as infrastructure goes, it's not that expensive. I mean, we've got towns here in our area that have built fiber to the home for, let's say, $3 million, for a whole project. Maybe a bigger town might be 10, it could get bigger than that, but these are, smaller towns that are doing ubiquitous or complete connections, as you mentioned, Brian, to everybody, fiber to the home. And then you've got, on the healthcare side, the spending is just, add some zeros. you got a hospital putting $300 million into, a building upgrade that could fund whatever, 50 small town fiber to the home projects. So even in the healthcare economy, there's so much, room for cost savings, really. They can claw back some of that somehow and put it into broadband.
One other thing, heck yeah, by the way, on cost savings and demonstrating how it reduces costs in healthcare, I think that's huge. The other thing I was going to add after listening to you, Will, was this is also a really good place for citizen action, right? When we think about areas where people could get involved and really mobilize in local communities, you have a lot of leverage at the local community level to say what you want your internet connectivity to be like in your community and to organize around that. And local communities, whether it's a city, a county, a municipality, a region, a state, they have quite a lot of power and agency in terms of advocating for that. And so I think something we haven't really talked about yet is the role of the public in terms of saying, we want this, we want to have a vote on this, we're willing to add an extra 10 cents in taxes a year if it means we all get free, awesome Wi-Fi. And there are also a lot of other things that we can do around access to technology and devices, which was something we were talking about earlier. And there are a lot of really interesting models about that. But I think we need more people having a fit about the state of broadband in America. It's pretty.
You ready to fire some people up? Light a fire?
Yeah.
You want to pull out a 6-pack of something? Is that what you're trying?
Where's my tequila? Give me a megaphone and
get yourself fired up.
Well, I mean, yeah.
But Rachel's making the same point I made earlier. The people with the loudest voice bring attention to a matter, but then when something's partially solved, those louder voices go away. We just need to we need to keep being loud.
Yeah.
Everybody does.
So what's that? So we're about out of time here, guys. And obviously we could talk about this. I think we've talked about having multiple discussions in this space. But I guess to close, I mean, Rachel, you talked about a lot of different points, and Sue, you did too, as far as education and knowledge. But, obviously we are in a pandemic, right? We're in a situation where the mind share is tough. People unemployment is sky high. People are stressed. Obviously mental health is an issue. So in a situation like this, if you had one thing each of you would tell, what do you, to get to that goal of, education, getting to bridging the digital divide and trying to bridge the inequity, what's the one thing, not 10 things, what's the one thing you would want people to try to take away and to do? Because obviously there's only so much mind share you can have, right? And people just don't have the mental capacity to keep doing everything. It's like that old saying, can't eat the elephant all at once. You can only, start at the tail or, go from there. So what would be that one thing each of you would want everybody that's listening, and as we distribute this out, what do you want them to take away?
Well, I think for me, the biggest thing is really carrying on from what Rachel's saying. You as a consumer have an amazing voice right now, bigger than you've ever had. And it is a right, it should be a basic right for all citizens of our country to have broadband, and adequate broadband for not only telehealth, but all the different things we've talked about today. So, don't let a good crisis go to waste.
I agree. I think with this crisis, I've wanted healthcare to redesign itself for a long time. And now is the time for virtual to be the default, for virtual to be the care for people with mental health conditions and cancer and, problems, going face to face. That should be the default. So it needs to be flipped on its head, but the system has to make sure that it doesn't perpetuate disparities, there have to be mitigations where people can get help getting that access and not just dependent on, having versus not having.
Absolutely.
Awesome. Brian, any last words? I think to add to that?
I love how this evolved into raise your voice, speak out, get involved in the community, stuff like that. You won't affect change unless you're involved. You have to be involved. So I love that concept. I think that's a good takeaway for me, for sure.
Absolutely. Well, listen, all, we've come to our time to close this session of Beer and Broadband, and I want to thank all of you for your insight. A lot of great conversation, and I think we're really ending this with, we all know we need broadband. We all know we need beer too. Activity, and I really look forward to everyone's participation in another future event. And thank you so much for spending your time with us today. Thank you, everyone.
Thank you.
Thank
Cheers.
you.
Cheers.
Cheers.